Castor oil. Castor oil. Castor oil. Castor oil. Castor oil.
Castor oil, nature's Botox, an alternative to filler, a simple cure for acne and wrinkles. There's so much buzz about the magic properties of castor oil. Some people are even saying that castor oil is like nature's Botox or an alternative to filler. I'm sure many of you have seen this video.
Castor oil for your face. Nature's Botox, it's often called.
And it's gotten a lot of views and it's gaining a lot of popularity. Although there are some great points in this video, there are many things that I don't completely agree with entirely, and that can actually cause some harm to select individuals. As a board certified dermatologist and a fellowship trained cosmetic dermatologist, I stand at a different vantage point and just wanted to do a video specifically focused on the effects of castor oil on the skin. Before we get started, I just want to let you guys know that I completely admire and respect Dr. Rajani, and this video is by no means to discredit the work that he's done, but I have a different vantage point and a different educational background that may provide some insight and a different perspective. If you ever see conflicting doctors on social media, especially on YouTube, it's always important to remember that we're all from different specialties. Dr. Rajani is an internal medicine or family practice physician. I'm a dermatologist. There may be some plastic surgeons that you follow who don't have the same education in skin as they do in surgery or other subspecialties. So if there's conflicting recommendations based on different YouTube physicians that you follow, just know that we all have a different educational path and background. So we may make different recommendations that may conflict with other doctors with respect to which products to use, skincare actives, procedures, and so forth. So let's start by, what is castor oil? Castor oil is an oil derived from the castor bean, Ricinus communis, and it has a lot of skin benefits. It's anti-inflammatory, it's antimicrobial, full of antioxidants, vitamin E, but there are also some misconceptions and some points I wanted to address because it can also have some deleterious outcomes on people's skin in a select number of patients. So if you're one of these people, hopefully you'll take away from this video things to look out for, or how to proceed with caution, or how to manage expectations appropriately when seeing all the hype on social media about castor oil.
Now, what are the benefits of using castor oil on your skin, and why exactly is it called nature's Botox? Number one, fighting acne. This may not be intuitive as it's a very thick oil, but castor oil has antibacterial properties. So bacteria on your face can clog the pores and lead to acne. Now, it is a thick oil, but it just doesn't cause acne, and in fact, it can improve acne. It will not clog your pores. When you put it on, you're really going to think that it will do that. It's that thick. I have it on now.
So castor oil for the treatment of acne. There have been statements made saying castor oil does not clog pores, or castor oil is the cure for acne. And although it may help some people with acne, that's not a true bold blanket statement that could be made safely for all individuals. As with any active ingredient, even vitamin C, vitamin A, castor oil, everyone's skin may be a little bit different. The pilosebaceous units may be different. The histology may be different. The P. acnes colonization of the skin may be different. The inflammatory cascades may be different. Each individual patient is different, and it's not safe to say that castor oil cannot clog pores and does not cause acne, because I've had a few patients who have read things online about castor oil and had beautiful skin to begin with, and they start using it and they've completely wrecked their skin. They have inflammatory cascades, they have hormonal acne, cystic acne, acne conglobata, follicular occlusion, congestion, acne scarring, ice pick scarring, inflammation, post-inflammatory hyperpigmentation, post-inflammatory erythema, and it's wreaked havoc on their skin. And I've seen a handful of these patients within the last month of my office who follow different accounts on TikTok and YouTube and implemented castor oil into their skincare regimen, and they started off with beautiful skin, and now it's completely backfired. So it's for those few patients who motivated me to put out this video to kind of include an all-encompassing, comprehensive view of castor oil to kind of supplement other videos that you guys may be watching. That is the purpose for my video today. I've had people comment in the comment section on videos I've posted about castor oil, and patients that I've seen in the office where they've had breakouts, they've had clogged pores, they've had stretched out pores and blackheads, and cystic acne, which led to scarring from people who have used castor oil. So although it may benefit some of you with acne, it's not true to say that it does not clog pores, because it can in some individuals based on their skin histology, the pilosebaceous unit, the density of the sebaceous gland, the sebum production, the age of the patient, the maturation of their skin, so many different factors. Yes, castor oil does have anti-inflammatory properties, and inflammation is a huge component of acne. Castor oil also has antimicrobial properties, and acne can be caused by the P. acnes bacteria. But there's also hormone influences on acne. There's endocrine influences on acne with respect to cortisol levels and other endocrinopathies in the body and the skin. And it also is a product of follicular occlusion. A hair follicle, or the pilosebaceous unit, which in skin histology is the unit that the sebaceous gland is attached to, where the hair follicle attaches, which is what the pores are on the skin. And the terminal hair, which can even be just a little baby vellus hair or peach fuzz hair, that is all associated with this unit. And if there's occlusion of the follicular ostia on the surface level of the skin, when you look at a skin on cross section and you look at the surface of the skin, the follicular ostia is the pore opening. That is where all the sebum gets excreted onto the skin. That is where all the cellular debris gets excreted. And if there's an oil that occludes that hair follicle, I don't care what type of oil it is, castor oil, olive oil, coconut oil, aquaphor, an emollient, petrolatum, it can occlude that follicle. Now that may not cause a breakout in everyone, but there are a select group of people that can cause a severe breakout, leading to acne and scarring and cystic acne. It can have scarring and post-inflammatory hyperpigmentation, post-inflammatory erythema, and textural irregularities, for which we need to laser and resurface to get their skin back to where it was before. So because of the multifactorial pathogenesis of acne, it's not just about inflammation or antimicrobial, and it can be caused by occlusion of the follicles that can happen with castor oil. So although in theory castor oil decreases inflammation and it can decrease the bacterial load, it's not safe from occluding that follicle. And when that follicle gets occluded, there's a backup of cellular debris, of sebum secretion and other things that can plug that up, causing more inflammation and more proliferation of the P. acnes bacteria. Open comedones, closed comedones, and even if the castor oil is sitting on top with its antimicrobial and anti-inflammatory properties, it's not getting down to the hair bulb or the ending of the shaft where the acne pathogenesis is occurring. So I'm coming at it from a perspective of a dermatologist. I know Dr. Rajani is an internal medicine or family medicine specialist, so maybe our pathways of education differ in our understanding of the skin, but I do want to have due diligence in protecting my patients from having, an acne flare-up or wreaking havoc on their skin for a misinformation of the effects of castor oil on their skin.
Now, moisture keeps your skin looking young, shiny, maybe glass skin if you like that, and healthy. This is why it's primarily called nature's Botox. It's astonishingly effective as an emollient, and it plumps like filler and removes wrinkles like Botox. Think pesky lines, accordion lines, lateral to the nasolabial lines, lip lines, anywhere the skin is thinnest, and of course it absorbs so well. They will disappear quickly and sometimes as quick as Botox.
Castor oil works like filler. So this is not true. Whether it's a biostimulatory filler like Sculptra, which is polylactic acid, or Radius, which is calcium hydroxyapatite, which stimulates the fibroblasts, which are the collagen producing cells in the skin, to increase collagen synthesis, that is a different mechanism of action in which biostimulatory fillers work in the skin. That is different than castor oil decreasing matrix metalloproteinases and acting like a free radical scavenger in the skin. It's not going to produce increased collagen synthesis. It can, however, protect the collagen that we have in our skin. So can it help with the appearance of fine lines and wrinkles? Absolutely. Does it work in the same mechanism of action as a biostimulatory filler? Absolutely not. Does it work the same mechanism of action as a hyaluronic acid filler to help treat nasolabial folds and marionette lines, fill in temporal hollows? No, it does not. It's not as effective and should not be compared to hyaluronic acid fillers or biostimulatory fillers, in my expert opinion as a cosmetic dermatologist. The second topic, castor oil as nature's Botox. So Botox and castor oil are two totally different mechanisms of action. They're two totally different pathways in the skin. The way in which a neuromodulator or Botox works in the skin is it inhibits the binding of the synapse-snare complex, which inhibits the acetylcholine, which is a neurotransmitter effect in the pre- and postsynaptic membranes of the nerves that innervate the muscles. So that was science language. Now in English, what that means is it just relaxes the muscles by a different mechanism of action. The way in which castor oil can help plump or smooth fine lines and wrinkles is by a different mechanism of action that has nothing to do with the pathway that Botox is involved in. The way that it can plump and hydrate the skin is through its emollient and humectant effects, which can pull in water and to help moisturize and hydrate the skin, which makes the appearance of fine lines and wrinkles look better. But the problem occurs with people who are trying to substitute their Botox with the use of castor oil. And then what they do when they're trying to do a good thing is they stop doing their Botox and then they get a breakout and their skin wreaks havoc from the effects of castor oil. They get dilated pores, they get blackheads, they get acne breakouts, and here they're trying to do a good thing. And I've had patients in my office who come in with these breakouts, and instead of coming in for their Botox treatments, they're coming in for laser resurfacing from the acne scars that they've gotten from using castor oil. So it's just really important to understand the perspectives and the pathogenesis in the skin, the different pathways that are involved, and have an appreciation for that, and also to manage expectations. If someone's going to purchase and use castor oil expecting the effects of a neuromodulator or Botox, that's simply untrue, and that's setting unmanageable and unrealistic expectations. So it's all about maintaining safety, avoiding pitfalls that can cause damage to your skin, and then not having anybody be disappointed by saying a blanket bold statement that castor oil is nature's Botox, and then being disappointed when it's not giving the same effect as 25 units of Botox would be given. Now, speaking about the pharmacokinetics of Botox and neuromodulators and the synapse-snare complex in the pre- and postsynaptic membranes and neuromuscular effects of botulinum toxin, when you're talking about a true nature's Botox, topical argireline actually works in that same mechanism of action. In my MDAiRE skincare line, of course, I have it in my neck tight serum, which is a serum for the neck and décolleté, which helps smooth and tighten that thin, delicate skin. I'm 46 years old. I use it day and night. I engineered it for myself and for my patients to have smooth, tight skin. That topical argireline is the closest thing that we have to Botox or nature's Botox or topical Botox, not castor oil. Castor oil, of course, can help hydrate and smooth fine lines and wrinkles, but it's not going to work via that mechanism of action. So just to distinguish the two, and if you guys follow me, I know you're more science oriented and you have an appreciation for the different mechanisms of action and the pharmacokinetics in which active ingredients work in the skin. So potential negative side effects of castor oil on the skin, it could be occlusive, it can cause an occlusive folliculitis, it can cause occlusion leading to acne, and with acne and cystic acne and inflammatory acne, there can come sequela from that. Again, post-inflammatory hyperpigmentation, which can cause little brown spots or pigment alteration over the face. Post-inflammatory erythema, where you're left with red spots where the cystic lesions were. You can have dilated pores, stretched out acne scars, blackheads, open comedones, closed comedones. It may not happen to many people, but I've seen it personally happen to enough patients that prompted me to do this video. So just be smarter about it, and if you do try using castor oil, maybe use it on one area of your face. I actually used it on my chin about 3 months ago when it was getting a lot of hype, and I actually had a breakout from it. And as a dermatologist, there's zero room for error for any skin ailments. I mean, I'm 46 years old. I struggle with acne, rosacea, seborrheic dermatitis, melasma, you name it. So my skin's very sensitive, and when I had a breakout from castor oil, it really, gave me empathy to empathize with my patients who have had the same experiences. And these are people that had pretty flawless skin to begin with, who took great care of their skin. So just, again, proceed with caution, and as with everything, be skeptical and understand different YouTubers or different social media accounts that you're following. Know what their vantage point is, and it's not a bad idea to look into people's credentials. Say you have a YouTube doctor who you really like. Where did they do their residency? Was it in dermatology? Was it in internal medicine? Was it in plastic surgery, where they spent 8 years of their residency in the OR? Once you start opening your eyes to people that you're following and looking at credentials and checking, background and educational information, it'll be really eye-opening, because right now within the medical community, in order to get hospital privileges at a hospital, say you're an orthopedic surgeon and you want to perform surgeries in a hospital, you have to provide credentialing in order to perform that procedure in the hospital. On YouTube, anyone can say that they're a skin expert. Anyone can say that they're knowledgeable in skin, even though they're a plastic surgeon or in a different specialty, and there's no accountability for it. So sometimes a consumer can be confused or have conflicting information or get themselves into trouble because they're taking the wrong piece of advice from the wrong subspecialty physician.
Castor oil is thick, so you should mix it with a carrier oil, at least to start with, before putting it on your face. I actually use it straight, but if you want to, you can put it with coconut oil. Almond is a good choice. Olive oil, there's many people that do that. Now apply this mixture to your face before bed. It's mostly a nighttime thing. After cleansing your skin, you then put on the oil, you leave it on overnight, or alternatively, you could wipe it off with a warm cloth after say 1 to 5 minutes. I like leaving it on overnight for most. It doesn't cause acne.
Why I'm not a fan of oil on the face. So as a dermatologist, we learn in our didactic lectures in our residency in dermatology, and then in our procedural dermatology fellowship, we learned the intricacies of all the signal transduction pathways and the pharmacokinetics of active ingredients in the skin. And as a Mohs skin cancer surgeon, I spent decades of my career looking at skin under the microscope and correlating the histologic presence of the skin with what I'm seeing clinically on my patients, which gave a huge, amazing advantage and viewpoint and vantage point when evaluating effects on the skin. And this is one thing that I will say. Oil is not healthy for the skin. I know a lot of people use oil on their skin, and when they touch their face, it feels nice because your fingertips are actually coming in contact with the oil that's sitting on the surface of the skin, but your skin cells need water, not oil, to hydrate. Same with every other cell in the organ system in the human body. When you're at the gym and you're working out and you grab your hydro flask full of water, you're not grabbing your hydro flask full of sebum or oil to hydrate your skin cells or your body cells or your body for that matter. Your skin cells need water, not oil, to hydrate. What oil does is it provides a protective barrier to minimize transepidermal water loss, but also natural moisturization factors and smarter actives that restore the barrier and provide a barrier to minimize transepidermal water loss work the same way, but they work more elegantly and scientifically because they're not going to cause occlusion and they're not going to cause acne and breakouts and stretched out pores and blackheads and whiteheads and open and closed comedones. So it's really important to understand the skin doesn't need oil to hydrate, it needs water to hydrate. And so once you kind of make that switch, I have patients sometimes that come in to see me and they have large pores and they have blackheads, and the minute we stop the oil use on their face and we start them on skincare actives that are going to allow the keratinocytes and the skin cells to hydrate from within, restore the barrier so that they don't have transepidermal water loss, and allow those skin cells to hold onto water, not sebum or increased oil production, but water, their skin looks beautiful, their pore sizes shrink, and they have beautiful, flawless skin without breakouts and without large, dilated, conspicuous pores and blackheads. And it's just, something that I've learned not only through my 20 years of dermatology training, but also just in practice and seeing patients day in and day out. So I want to fight the misconception that oil is good for your skin, because it's usually deleterious for the skin. It can cause breakouts, stretch out pores, blackheads, a lot of bad stuff. I know if you're addicted to your oil on your face and you know that it feels good, remember your fingertips are touching and sensing the oil that's sitting on the face. The true test is after you take a shower and everything's washed off the surface, what does your skin look like? Is it dry and kind of peely, or is it hydrated and plumped and rejuvenated? And usually when you use skincare actives that are going to upregulate the skin's ability to hold on to water, that's when you have beautiful, flawless skin.
What about those dry lips? It's amazing. It's an amazing hack, and few people really talk about the magic here in the lips, but it's a very common ingredient in both lipstick and glosses. If you have dry lips, skip the color, use castor oil.
Absolutely. I'm a huge proponent of castor oil for the lips. It can help lip hydration. It can help with the lip keratinocytes to maintain a plump effect by minimizing transepidermal water loss, allowing those keratinocytes to hold on to water and plump from a cellular level and within. Do I feel that it is going to be equivalent to a peptide lip mask or a highly engineered, very smart scientific lip mask? No, but I do feel like it's a great alternative and a better price point for dry, chapped lips or hydrating the lips. It also can help with angular cheilitis, which is kind of the dry, cracked fissuring that we get in the angles of the mouth that actually is a problem from excess saliva as we sleep, and yeast forms that can affect the angles of the mouth. Is it better than doing nothing? Absolutely. Is it going to be the equivalent of a peptide lip mask like the MDAiRE peptide lip mask? Absolutely not.
can soothe a sunburn as well. Many of you use aloe, but due to castor oil's anti-inflammatory properties, it eases the pain associated with the inflammation, but at the same time, it's so moisturizing, it reduces the peeling. And that's another aesthetic benefit. Now, I don't want you getting sunburns, of course, but if you do.
So because of the anti-inflammatory properties, castor oil can be beneficial in the treatment of a sunburn. Hopefully you guys aren't getting a sunburn in the first place, but when there is a sunburn, that is your skin's response to trauma, and the trauma in a sunburn is radiation from ultraviolet light. And with that happens a lot of inflammatory cascades, prostaglandins, interleukins. These are cellular mediators that are released in times of trauma for your skin to kind of regenerate and to recover from the traumatization of the ultraviolet radiation. And so castor oil, because of its anti-inflammatory properties and its antioxidant properties, it can help diminish the inflammation and discomfort from a sunburn. So I absolutely would recommend castor oil in the treatment of a sunburn, but A, hopefully you guys aren't getting sunburns in the first place, and B, I think there's also alternatives that can absolutely do the same thing, but I don't want to discredit castor oil's effect in inflammation and mitigation in the skin from a sunburn.
Now, what about the prostaglandin effects around the eye? Prostaglandin analogs, and they have been shown and known and proven to reduce the fat around the eye, and it's where you don't want to lose fat. Well, there is some prostaglandin effect of castor oil. I personally have never seen someone come in who's been on it who's lost their fat pads. There's no real data on this. You want to put it on and then don't overlap. You don't need to get it on the upper lid or the lower lid, or of course in the eye.
Although it has been known to be a prostaglandin analog and can help grow new hair in the eyelashes, in the brows, even hair on the scalp, just be careful with use around the eye, because it has been shown to cause corneal abrasion, corneal ulceration, and if it gets in the eye, it can be catastrophic and deleterious. So I've had some patients have issues with this in the past as well, and just when you're applying it on your lash line, you can include hair follicles there too. Now, the glandular component of the skin on the eyelids is different than that on the face, and instead of getting acne and breakouts, you can get a chalazion, you can get a hordeolum, also known as a sty, or those big inflammatory bumps that you can get on your lash line that can be very annoying and require antibiotics or incision and drainage procedure by your ophthalmologist. So just proceed with caution, because for those of you who have sensitive eyes or may be more prone to styes, you have to be careful with that as well. I'm not here to say anything negative about castor oil. I think it has immense skin benefits and can do a lot of good for multiple organ systems in the body. The GI tract, I know it's a known laxative for post-menopausal bloating, but again, refer to the subspecialist and area of expertise of the physicians that you're getting this information from, because as a dermatologist, I'm not in a position to talk about the gastrointestinal or laxative effects of castor oil and the GI tract, as I'm not OBGYN or a women's health physician that I can comment on the postmenopausal bloating effects of castor oil, but I can talk about the skin. And so hopefully this video was helpful talking about the benefits of castor oil in the skin and just kind of managing expectations, and also informing you guys with a little bit more insight from a little different perspective to help prevent any deleterious outcomes or breakouts or harm to the skin that could be associated with castor oil in select individuals. As always, you guys, I'm non-sponsored. I hope you enjoyed this content. I make these videos for you because I love to do it. I love sharing knowledge, and it gives me purpose, and I love sharing information with those who are interested. Drop a comment in the comment section. Let me know how you guys are having, your experiences with castor oils, positive or negatives. This is a safe community. Again, no sponsorships, no paid partnerships. This is purely organic, and I love the exchange of information that you guys provide, not only with me, but with one another. And if any of you have had a positive or negative experience with castor oil on the skin, on the hair, as a laxative, just let me know. And I want this to be a very safe forum with just nothing but positivity and shared information in a safe space that's not influenced by big pharma or any companies or paid sponsorships. And for that, I will be true to that until my last day. All right, you guys, I love you.